selenium and Hashimoto's specifically, and this is a level A evidence study. This was a prospective evaluation of 80 women, and it was, crossover placebo control. Well, actually not crossover. They gave all of them for the first 6 months selenomethionine. And that's a good form of selenium to take. It's not like sodium selenate. This is the chelated form of selenium. So 200 micrograms a day, that's a pretty typical dose we like to give people for the first 6 months. Then after that, they took half of them off the selenium, and they kept half of them on for another 6 months. The TPO antibody reduced by 5.6% by 3 months, 9.9 at 6 months, and 21% reduction at 1 year in the people that stayed on. But the people who stopped their selenium at 6 months, their TPO bounced back up over the next 6 months. So that's a better, study looking at, okay, it's stopping therapy in half, and you can see this differential. There were not really any clinical effects reported in this abstract. They're purely looking at antibody level. So Graves' orbitopathy and selenium, this was a big multi-center placebo-controlled RCT, so level A quality evidence, showed that Graves' patients showed beneficial effects on quality of life and overall eye involvement from their disease, while also reducing the progression of eye disease, and if they had some. Okay, so if you have a patient with Graves' disease, it should be, you would think, standard of care to give them selenium. You will never see that suggested by their conventional doctors. And if, odds are if you have a patient with Graves and you tell them to take selenium, their conventional doctors will probably tell them that not to take it because that's nonsense. And that, of course, nutrition has no role in human disease. But this is published research from 2013, fairly recent research showing that selenium in Graves directly reduces the eye complication. And destroying the thyroid gland does not. Neither does any other conventional intervention. So there's a couple of studies coming out. Selenium is being looked at, and these are both trials that are in the works and that are currently in enrollment. And they were both investigator-initiated, meaning people that have done previous research, like the slides I've shown, want to know more about the effects of selenium in people with thyroiditis. So there are a couple of big articles on their way. So zinc, we'll talk about zinc. I mentioned it in the hypothyroid lecture briefly. It's got interesting, I think, mixed response in autoimmune thyroiditis. So a cross-sectional study of 200 people, not a ton, correlated zinc levels with thyroid gland volume, with thyroid levels in patients after iodine replacement. So they had already been given iodine, and they're looking at anti-thyroid antibodies too. Zinc was positively correlated with T3 levels, so there's some improvement in conversion pathways. It was negatively correlated with thyroid volume in patients with nodular goiter. So if they have nodular goiter, giving them zinc would help shrink their goiter. Zinc was positively correlated with thyroid antibodies in those with autoimmune thyroiditis. So that's a negative effect of zinc in what we're talking about, which is interesting. There's obviously some mixed response. Biological systems are complicated, and one nutrient often has lots of different roles. So this would argue against giving zinc to people with autoimmune thyroiditis. It doesn't reflect clinical outcome necessarily, and I don't know if this is a transient response, but one published study, anyway, for 2010 says zinc will maybe increase the autothyroid antibodies. So this was the only one I could find in PubMed when I searched zinc supplementation autoimmune thyroiditis. It was the only study I could find. And I think that there needs to be more research into that specific question, because there's other research showing that zinc is helpful for hypothyroid states. And this is just one study, which wasn't necessarily clinically focused. But the best suggestion I can give now does not include giving zinc to these people based on that one study. So vitamin C, which I use a lot, mandatory for these people with thyroiditis in my practice. There's no published research at all on PubMed. I've looked, a number of different combinations of searching. I can't find anything as far as the autoimmune effect itself, or thyroid function, or iodine uptake, or anything. But in clinical experience, it seems to facilitate tissue uptake of iodine, and therefore it's important as an adjunctive thing to give with iodine. But that's just level C, my experience and my comment. Vitamin D, one of my favorite things, and the next lecture in a couple of weeks is a whole 2 hours devoted to vitamin D, because I like to talk about it so much. But in thyroiditis, which is an autoimmune state, and vitamin D helps mitigate pretty much all autoimmune reactions. This was actually 125, the top study, dihydroxyvitamin D, so calcitriol, the active form, if you will, of vitamin D, was shown to decrease the induction of experimental AIT in mice by over 60%. So that was giving the mice sodium iodide to try to impose or cause autoimmune thyroiditis on them. If you gave them enough, vitamin D, it prevented this by more than 60%. So that's a big deal. You would think